Hello everyone and welcome to sqadia.com. I'm your educator, Dr. Ali Imran, and today the topic of our lecture will be thoracic trauma imaging. So in order to outline the lecture, we will be discussing about whenever there is chest trauma, which modalities to use. Now this is a very important topic because a chest trauma is usually an emergency, and during an emergency, which modality to use? Should we use standard radiograms? Should we use CT scans? Should we use HRCTs? What kind of modality to use? This kind of decision is not only critical to the patient care but also makes a good doctor. So we will be discussing about the choice of the modalities. Then we will be studying about the different traumas which are found during chest trauma. The first damage that we usually see is the rib fracture. Now, how the rib fractures happen, where they happen, what are their complications, we'll be studying about those. We'll be studying which modalities to use whenever we observe a rib fracture on the physical exam, and so much more. The next thing we'll be studying would be interpretation. Now, if there is a rib fracture, how to interpret it? Which organ is punctured? How much is punctured? How much, to what extent, what happens? All of these interpretations will be discussed in the lecture. Next, we'll be discussing about the complications. Now, rib fractures not only produce on-spot damage, but they also complicate other things. How they complicate, which complications occurs, how to treat them, and how to visualize them, how to find out on the imaging that these complications are happening. We will study about those. Next, we'll study about dyspnea and the selection of its modalities. That whenever there is dyspnea, which modality to use, plain X-ray or CT scan or even MRI. Then we'll be studying about its interpretation. If this is happening, how to interpret it. If dyspnea is happening in a patient with this, then what it means. All of the interpretations will be discussed along with visual aids. Next, we will be discussing about acute dyspnea. Whenever patient suffers not from chronic but acute, the sudden onset of dyspnea, and what type of imaging should be used then. We will also be studying about hemoptysis. Now, hemoptysis is the coughing up of blood. Now, why hemoptysis occurs, how it occurs, where it occurs, which imaging to use, and how to find out the location or the site of hemoptysis in those images is what we will discuss in the lecture. So, stay tuned for the lecture and do visit sqadia.com for a variety of lectures on a variety of topics, from ENT imaging to clinical radiology to shoulder pain. We will be discussing everything. So do visit, and thank you so much for watching sqadia.com.